Good morning. My name is Drea and I am a licensed esthetician here at Beau Visage Spa. And if you are not sure, I will let you know that August is Psoriasis Awareness Month. So I have gathered some information about this skin condition to kind of raise your awareness about what it is, who it affects, and even some ideas on how to get some help with this condition if it is something that you are suffering from. So first of all, what is psoriasis? Psoriasis is a skin disorder that causes skin cells to multiply up to 10 times faster than normal. This makes the skin build up into red and bumpy patches covered with white scales. They can grow anywhere, but mostly they appear on the scalp, on the elbows, on the knees, and the lower back. Psoriasis cannot be transferred from person to person, so it's not something that's contagious. There are things that will trigger psoriasis, and psoriasis generally will have flare-ups and remission periods, kind of similar to rosacea and to eczema. So things that we know that trigger psoriasis. Psoriasis triggers are not universal. What can cause a flare-up for one person might not have any effect on other people. So as far as what we know that are established psoriasis triggers, it would be stress as one of the main ones. So stress can cause psoriasis to flare up for the first time, or it can aggravate existing psoriasis. Relaxation and stress reduction may help prevent stress and help it from impacting the psoriasis to get worse. The other thing that can trigger a flare-up would be injury to the skin. So psoriasis can appear in areas of the skin that have been injured or traumatized. They call this a Keebner phenomenon. So vaccination, sunburns, scratches, they can all trigger a Keebner response. The Keebner phenomenon can be treated if it is caught early enough. And injury to the skin we talked about. So for a person with psoriasis, this is important to identify what triggers and symptoms. And some other common triggers that we know of would be smoking, so cigarettes, alcohol, infections, certain medications such as beta blockers. Actually, the one that we were talking about on the news that they were thinking could treat COVID, I forget how to pronounce it, but I actually read that can also irritate. They were saying anti-malaria drugs can sometimes irritate as well, so just something to think about. Always talk to your doctor about your skin conditions and before going on any medications to make sure that they're a good fit for you. And the other thing would be some foods actually can trigger it. So gluten, dairy, citrus, for some people, it can actually worsen the flare-ups or cause infection. So anything that can affect the immune system can affect psoriasis. In particular, strep throat is associated with a certain kind of psoriasis, and that strep throat often triggers the first onset of the psoriasis in children. And you may experience a flare-up following an earache, bronchitis, tonsillitis, or respiratory infection. It is not unusual for someone to have an active psoriasis flare-up with no strep throat symptoms. Talk to your doctor about getting a strep throat test if you have a psoriasis flare-up. And there are other possible triggers. Although scientifically unproven, some people with psoriasis suspect that allergies, diet, and weather triggers that weather will trigger their psoriasis. More than 8 million Americans have psoriasis, so that is quite a lot of people that suffer from this. Psoriasis often starts between the ages of 15 and 25 years old, but it can develop at any age. About 1 in 3 people with psoriasis can develop psoriatic arthritis, hopefully I'm saying that right, which affects the joints, the tendons, and the ligaments. Psoriasis is also linked with comorbidities such as diabetes, heart disease, and depression. The symptoms of psoriasis can be different depending on what type you have, and I thought this was really interesting. There are 5 main types of psoriasis, and each type has different symptoms and characteristics. People with psoriasis have they can have 1 or more types of psoriasis at once. You can have different types of psoriasis at different times. Plaque psoriasis is the most common. It appears as raised patches of inflamed, itchy, and painful skin with scales. And for some people, the skin may look red. It can have silvery white scales. For others, this might look more like a purple color. These plaques most often appear on the scalp, the knees, the elbows, and are in or around the belly button, the lower back, but they can also affect any area of the body. Inverse psoriasis is the second most common. It appears as inflamed, deep red skin that is smooth and not scaly. Inverse psoriasis affects body folds such as underarms, under breasts, in the genital area, and the buttocks. It can cause severe itching and pain, and it can be worsened by sweat and rubbing in these areas. And then there's also the guttate psoriasis, and this is the third most common. It appears as small, round, red spots caused by inflammation that are raised and scaly. And the guttate psoriasis often appears on the arms, the legs, and the torso. However, it can actually affect any area of the body. There are more facts about psoriasis. So more than 8 million people have psoriasis in America alone. Psoriasis often starts between the ages of 15 and 25, but they can develop at any age. And about okay, we already went over that. Just kidding, guys. Sorry, I'm rereading my notes and I'm like, I think we already talked about that. So what are the symptoms of psoriasis? So the symptoms of psoriasis can be different depending on what type you have, and there are 5 main types with the different kinds that we were talking about. So to kind of finish up what we were talking about, the pustular psoriasis is rarer, and it appears as pustules, white pus-filled painful bumps. They may be surrounded by inflamed or reddened skin. The pustules are filled with pus, but they are not infectious. The pustules are filled with pus, are not infectious. This means that they are not caused by an infection. They're not contagious. Pustular psoriasis may appear only on certain areas of the body, such as your hands and your feet, and they might even cover most of the body. The other kind would be the erythetic this is really kind of a long word here, so I want to pronounce it correctly. It's the erythrodermic psoriasis. Now, this is the most rare form of psoriasis. It can cause intense redness and shedding of the skin's layers in large sheets. It often affects nearly the whole body, and it can be life-threatening. Other symptoms include severe itching and pain. It can actually have changes in the heart rate and temperature, dehydration, and nail changes. You should see your healthcare provider immediately if you think you are having an erythrodermic psoriasis flare-up. That one is the most serious. So biologics are made from living sources such as human, animal, or bacteria cells. They are given as an injection or shot or intravenous, so an IV, a slow drip of medicine into your vein. Biologics work by targeting and lowering the overactive part of the immune system to decrease inflammation and help with psoriasis flare-ups. There are also oral treatments such as medications that you can take by mouth. Some oral treatments, they target specific cells of the immune system, and the others may act on your whole immune system to decrease the overactivity. The other remedy is phototherapy, so light therapy. They use ultraviolet light to treat psoriasis under the care of your healthcare professional, so probably a dermatologist for this one. Treatments can be given at your healthcare professional's office, a psoriasis clinic, or sometimes even at home with a prescription home phototherapy unit, so a light unit that you can take home. And there are topical treatments that are applied directly onto the skin, and they come in different forms such as creams, lotions, ointments, or even shampoos, because remember we talked about psoriasis can even affect the scalp sometimes. And other treatment, and some of those you don't even have to get prescription strength, you can get them over the counter. Other treatment approaches may include complementary and integrative health that include natural products, mind and body practices, and other treatment methods. Some examples are pain management and health promotion, such as dietary and lifestyle changes to help with your psoriasis. So because I am in love with holistic practice and actually treating the root cause of things and trying to avoid as much of the side effect causing medications as possible. I mean, sometimes we need them. Sometimes we can do things alternatively with alternative medicine and get great results without some of the side effects that traditional medicine can bring. So I like to include these today. And the first one is mind and body therapies. So because stress has been proven to trigger psoriasis in some people, you can find that these techniques will be helpful in controlling psoriasis. So the first one is actually aromatherapy. Aromatherapy is the use of pleasant smells to help you to relax and lift your mood. Fragrant oils are extracted from flowers or plants for aromatherapy, and essential oils can be diffused through the air or applied to the skin during massage or bath. I will tell you, just from years of experience, you will want to use a carrier oil if you're going to use a essential oil. Almost none of them, as far as I know, can be applied directly. There are a few, but I would check with a practitioner or someone that's really well versed in aromatherapy before just diving into it. Do your research just to make sure there's no reaction. You can also do a patch test and make sure that it's not something that you're particularly sensitive to. So among the best oils to use for treating psoriasis, they recommend tea tree oil and chamomile. So chamomile is really soothing and it's fabulous for reducing inflammation. And then tea tree oil is actually a close relative to manuka. And we know that manuka honey is really soothing and healing for the skin. Tea tree is fabulous. It is one of the best essential oils, especially for breakout prone skin. Without the over drying of the skin, like benzoyl peroxide, it actually can help with breakouts too. I love it as a spot treatment, but we're talking about psoriasis today. So there's also rose and lavender that's recommended for aromatherapy with psoriasis. And meditation. So of course, meditation is my favorite. I think it's kind of like something that will help with almost anything, because our minds are just so powerful. So meditation, you learn to focus your attention and suspend the stream of your thoughts that normally occupy the mind. That's the definition I have for my notes, but I would like to say that meditation is really more about becoming the observer of your thoughts. You can never stop your thoughts from coming. They're going to come. So I would say that just think of yourself as watching a parade when you meditate, and the parade that you're watching is your thoughts. And every time you accidentally join the parade and you start thinking your thoughts and you realize that you're now in the parade and you're just thinking thoughts, you can come back to your breath and join on the sidelines and celebrate that, because you want to make sure that it's a positive experience. And even the best meditators that have done it for a very long time still cannot ever stop their thoughts necessarily. They're just becoming mindful and not joining the parade as frequently. But the practice of bringing yourself back from actively having the thoughts and just becoming the observer, that is meditation. So there's more to it. If you want to look up 10% Happier, it's a book that I really enjoyed. I think it's a great read. It's written by Dan Harris. And it really breaks down meditation, especially for us Americans that are always go, 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 go. And the concept is not necessarily as natural to us as maybe like Eastern cultures where it was kind of thought of. So yeah, definitely encourage everyone, no matter who you are. I have a 6-year-old and she meditates before bed. So you're never too young. You're not doing it wrong. I highly encourage you to do meditation, whether you have psoriasis or not. It has changed my life. I can't say enough good things about it. But as far as meditation goes, that is really going to help with mental calmness, psychological balance, and relaxation. And it can help with changing how you relate to the flow of emotions and thoughts in your mind. I think it just gives you a couple extra seconds before running into your fight or flight, where you are becoming more reactive. I found that meditation has helped me to take a bit of a pause and kind of examine how I want to proceed with different things that come up in my life that are stressful. So meditation is awesome. Look into it. It's amazing. Mindfulness is the other thing. So if you don't necessarily want to get into meditation, or you find mindfulness easier, mindfulness is a key element in many forms of meditation. But mindfulness is becoming or remaining consciously aware of what is going on internally and externally. through the mind, the body, and the senses. Mindfulness practice includes seated meditation and movement-based techniques. Mindfulness seems to be an effective technique for individuals when dealing with chronic pain and also stress. So mindfulness is awesome. You can go on YouTube right now, once you're done watching the live, of course, and check out chocolate meditation. Chocolate mindfulness. It only takes a few minutes. You can do mindfulness whenever you want. You're just becoming aware of the present moment and you're living in the now. You can do it with your breath because there is no future breath. There is no past breath. There's only the current breath as we're breathing. So that's why meditators and mindfulness practitioners, they will tap into the breath. But it can be just becoming aware of your surroundings on a nature walk. It can be just anything you want to become aware of the present moment. And you would be amazed how much this will change your life, and it will actually help with skin conditions, psoriasis, stress, you name it. So there's that. A 2011 study in the Clinical Journal of Pain found that mindfulness-based approaches played a small but significant improvement in pain reception for individuals. A growing body of evidence suggests that an imbalance of bacteria in the gut and gastrointestinal dysbiosis, which basically means an unbalance, can cause psoriasis and other inflammatory diseases. A 2015 study showed that people with psoriasis have less diversity in the gut microbiota than healthy individuals. And just to kind of explain that a little bit easier, so you may or may not be aware of the gut health that everyone talks about. We see it a lot. Basically, we are 90% bacteria cells in our body. That's bacteria and viruses and fungi and things like that. And we are only like 10% human cells. So they are beginning to find that the gut health is basically everything. They even think it's kind of like a second brain. And I have learned that things like psoriasis, acne, eczema, and rosacea are all tied to gut health issues. So dietary and lifestyle changes can make a huge difference in your skin because stress is pretty much a huge trigger for worsening all four of those conditions, and especially in psoriasis. So thinking about getting more fiber in your diet, if your diet allows, like as long as you don't have a restriction, because I know not everyone can do that, but just get with a nutritionist or your healthcare provider and, start talking about having these conversations about gut health if you think that it will benefit you, and I guarantee you it will. So increasing your fiber and decreasing added sugar. Fruit sugar is okay, but added sugar is in almost everything, and that starves your gut biome of having a diverse amount of bacteria. So a lot of people think it's good bacteria versus bad bacteria. That's not really the case. We just want a lot of bacteria. We want a lot of different ones because they all do different things for the body and they're there to help you. But when we have a lot of inflammatory foods in the diet, like dairy and sugar, you're going to see things like acne and psoriasis, eczema and rosacea worsen. So just something that I've learned. There's a really awesome book I want to link in the comments, and it is a natural healing for psoriasis, eczema, acne, and rosacea. I believe the author's name is Shan Nix Jones. You can get it at the library. They do have it at the Champaign Public Library, and for those that are watching in other places, check in with your library. They probably have it as well. But the author is amazing, and she goes on to teach you about eating fermented foods to balance your gut health and removing things like dairy and added sugar and more green leafy vegetables. You guys, you cannot go wrong with more green leafy vegetables. They will help your skin so much. So not to be your mom or anything, but Popeye was right. Spinach is really good for you. Kale, you've got to get a good balance in your diet. You have to eat the rainbow, and this is going to help your skin, and it's going to help your mood. You would be amazed. So I don't want to keep rambling on, and I feel like I've given enough stress relieving tips because normally I end with a stress relieving tip, but it's pretty much always meditation. So be aware of the present moment. Just take 60 seconds, pay attention to your breathing today, and I look forward to seeing you guys on Wednesday, and we will have another class. And thank you for watching. Take care.